We're in the middle of a heat wave with record temperatures. What role has climate change played, and how does the forecast look for future summer temperatures?
To put it simply, the world is warming as a result of climate change, and that warming is speeding up. In the future, we can expect more hot days as well as hot nights and also more heat waves, which means several days in a row that are very hot. In addition, we expect the hot season to be longer, so that means very hot days that will occur earlier in the year as well as later in the year.
What impact do these temperatures have on human health, both short and long term? Please talk about some of your research in this area and some of the health impacts that may be less obvious to people.
Dozens of studies, including many by our team here at Rollins, have shown that outdoor heat exposure can lead to visits to the hospital as well as in some cases to death from a wide range of causes, including cardiovascular, respiratory, and kidney diseases, as well as certain types of injuries, for example, those from self-harm or from interpersonal violence. And to put that into context, we recently did some work with researchers from around the world to estimate the burden of disease from heat exposure and found that about 500,000 deaths every year can be attributed to heat. We did a similar study, and we also found that about a third of all heat deaths can be attributed to climate change that have already occurred.
Aside from temperature change, what are some other aspects of climate change and human health you're concerned about that should be on our radar?
Climate and weather affect so many of the risk factors most associated with disease burdens globally, and therefore we worry that climate change can really have a profound impact on human health. Some of the things we're working on at Emory relate to changes in air pollution from wildfires and dust storms and changes in exposure to pollen. Flooding is another thing we worry about when it comes to climate change, both the direct impacts such as drowning, but also how it may worsen mental health outcomes. And we're even looking into how it may change exposures to hazardous waste if flooding and sea level rise start moving around contaminants that are found in hazardous industrial sites. And some other issues we are thinking a lot about are changes in infectious disease dynamics and how issues of food security and agriculture may affect diet and nutrition-related health outcomes.
What can we do at both a personal and policy level to effectively combat climate change and prevent future disaster?
All reductions in carbon emissions will limit future climate change, and because we all rely on fossil fuels for many of our daily activities, there are many opportunities to reduce future warming. Researchers here at Emory and others have found that well-designed climate policies can simultaneously improve public health while reducing future climate change. So some examples are if we were to reduce carbon emissions from power plants or automobiles, we would improve air quality. If people shifted towards healthier plant-based diets, they would improve their nutrition-related health outcomes. And moving towards active forms of transportation like walking and cycling could improve physical activity.